Good afternoon. My name is McLean. I'm going to present to you my Assessment 2 Clinical Portfolio. So in accordance to ESSA's scope of practice for an exercise physiologist, I'm going to go through the 7 points, starting with number 1. So screening and risk stratifying to ensure the safety and appropriateness of exercise and physical activity interventions. So we had Alan come into clinic. He wanted to increase his physical fitness and decrease body fat. And it was in accordance to ESSA, and we gave him our adult pre-exercise screening tool, APSS. So going through the APSS, the following points were highlighted and deemed necessary to take notice before putting Alan through the exercise program. So it was highlighted that he has sedentary lifestyle leading up to this, which is a risk factor, along with family history, elevated blood pressure, so more 140/90, and he has type 2 diabetes. So with these points highlighted, we advise Alan to go to the GP and get clearance to start with an exercise program. And on return from his doctor, Alan was allowed, participation in a progressive cardiovascular and strength training program with adequate supervision. It was also further encouraged by his GP to educate Alan on nutrition to help with his diabetes, which is good. So, and the APSS benefits fitness professionals in designing exercise for their clients. This is Norton et al. 2012. Okay, number 2. Assessing a person's movement capacity in people of all ages and levels of health, well-being or fitness. So we had John come in. He's complaining of lower back pain. So we went through a few movement assessments, see if any movement dysfunctions there that could be the cause of this lower back pain. So we've got to perform an overhead squat assessment. Thanks to Perth and Padera, 2007. And it was evident that he had excessive forward trunk flexion and knee valgus, which is knees internally rotating. We also did the flexibility sit and reach test. Okay. So I'll go through some of the points in regards to his initial test of the overhead squat. So forward trunk lean could be potential overactive muscles, so soleus, gastrocnemius and hip flexors, and potential underactive muscles, okay, anterior tibialis, posterior tibialis, and rectus spinae. So with these points, and the knee valgus, potential overactive muscle, again, hip adductors, biceps femoris, short head, tensor fasciae latae, and lateral gastrocnemius, vastus lateralis, and potential underactive muscles, gastrocnemius, hamstring, glute max, and vastus medialis. So with this in mind, you can take these on and design a program to try and reduce these movement dysfunctions, which could be leading to his lower back pain. So back to the sit and reach test. So overall, the sit and reach have a correlation for estimating hamstring extensibility, which then could be putting excess pressure on his lower back through pulling of his hips. And further to this, we did a Trendelenburg assessment, and showed active trunk lean in the frontal plane towards the stance side, okay, and so weakened hip abductor, so glute med on the stance limb, resulting in elevation of the non-stance ilium. Thanks to Udaz, Mraz, Norstad, Shink and Holman, 2007. Okay, number 3, so development of safe, effective, individualised exercise interventions. So we had Adrienne, she's a 51-year-old female who recently underwent surgery on an ACL. Her right ACL was torn, and the hamstring was used on the same side to reform this ACL and attach where it once was. So she's 6 weeks post-operation, and we designed a knee strengthening program in accordance with the physiotherapist and surgeon. So I'll go through each exercise and the justification for this being so. Warm up, general there. We chose closed kinetic chain exercise to reduce strain on ACL graft, thanks to Metzger 906. So we did some partial body weight squats to really try and encourage the vascular obliquus activating there. We did some unilateral single leg step ups on just a 20 centimetre high box, but encouraging full knee extension, again for BMO. And then we also concentrate on the eccentric lowering of the movement, which has been shown to improve quadricep strength after ACL reconstructions, thanks to Leclerc and Smith, 2013. Some standing stiff legged deadlifts, just light 5 kilo deadlift there, so try and encourage the hamstring activation there, especially on the graft side. Obviously trying to reduce any chance of straining that, but again further trying to increase a bit of strength at the same time. Standing calf raise for gastrocnemius, which is obviously runs over the back of your knee there, so increase strength around that joint. And we also did some proprioception work, so single leg balance and wobble board, which has been shown to further again encourage strength and awareness in the rehabilitation process of an ACL graft, thanks to Owen Campbell, the fact being Blackwood Award in 2006. Number 4, so provision of health education, advice and support to enhance health and well-being. So just recently, 8 practicing priests from the Philippines, Korea, Indonesia and China were at local beach. Okay, and had a bit of a scare. They got no real physical fitness there and had to be rescued by the surf lifeguards. So Father Peter Jones from St. Augustine's College got in contact with the clinic here and suggest that we maybe put together a bit of a workshop, a bit of a Q&A time for these priests, there's 8 of them, and for them to get a bit of information about how they can possibly increase their physical fitness and therefore reduce obviously any of these scares again, but also further reduce any chance of any kind of chronic condition, whether it be diabetes, hypertension or anything like that further. So, unique risk factors for developing diabetes in Asian populations here. Okay, so an interventions have been shown to be effective in preventing diabetes in Asians, thanks to Weber, those are standards of 2012. And this is some of the handouts we gave to these guys, just in accordance to the Australian government. As you can see here, so it's a fact sheet on physical activity and the benefits of, and the evidence showing that the health-related issue that could come with sedentary behaviour, which was their general being. We also incorporate some healthy eating guidelines, thanks to eatforhealth.gov.au by the Australian government there. So trying to eliminate too many sugars, salt. It's more of a natural form of food there. Some clean eating, as they say. So Australian dietary guidelines here, just highlighting a few points that they can take away and read up on and trying to incorporate into their everyday life. And at the end, we also gave a little quiz to go through, again, all from the Eat for Health through the Australian government there. And after getting them all answer very similar responses, it was evident that it was time for an overhaul. So they took this away and have started to incorporate a few of these new things into their lifestyle, which is great, and we've seen some really good results. Okay, number 5. So provision of exercise intervention and advice for those at risk of developing a chronic condition or injury. So we had Maddie come in. Maddie is a 14-year-old female who plays representative netball. So we all know there's a lot of evidence out there that say young females are at very high risk of ACL injuries. Okay, so she referred to the clinic after complaining of slight knee pain following netball games. So that highlights one straight away. So we did this 10-second tuck jump assessment. So we viewed her, we videotaped, and we could see excessive valgus movement through her knees on landing and pushing off. Okay, so as I said before, it's been evident that females demonstrate 4 to 6 times higher of non-contact ACL injuries than males, thanks to Meyer, Ford and Hewitt 2008. So the first thing we did was we tried to teach Maddie how to jump. Okay, so we got her in front of a mirror, we told her about the knees and the importance of keeping those knees tracking. And so we explained importance in neuromuscular training is recognised as an effective intervention for injury prevention. Okay, thanks to James, Beckham and Kelly. So we explain the importance, acceleration, deceleration and knee alignment. We incorporate some single leg strengthening work to try and get that tracking of her knee, single leg squats, and again just constantly encouraging the knee alignment and focusing on technique of movement. And you've got to take into consideration for other people individual biomechanics, so everyone's biomechanics is different, it should be taken into account when designing a prevention program. Okay. Number 6, we've got the provision of clinical exercise prescription for those with existing chronic and complex medical conditions. So we had Sam come in with a 21-year-old male suffering from chronic lower back pain. He suffered from bungee jump incident in 2011. So in accordance to McGill, he's done a lot of work here on lower back pain. We incorporate a lot of isometric holds, modified Pilates type movements, opposing leg and arm, side plank, cat stretches, and this has been shown to have a significant reduction in participation's pain intensity. Thanks to McGill again. And so we target areas of functional deficiencies. So it was evident that he was very stiff through his core there, inability to rotate, so we incorporate some functional movements there to try and encourage TVA, internal external obliques, and so obviously appropriate to these spine. So it's also been shown stretching. Okay, so we stretch the tensor fascia, the hamstring, and the adductor magnets, and also been shown to help with chronic lower back pain. Okay, number 7, provision of rehabilitation and advice to patients following the acute stage of injury, surgical intervention or during recovery to restore functional capacity and well-being. So Jake came in, he was referred to the clinic following a hamstring strain in a rugby league match on the previous weekend. So we gave some advice to Jake. He's still doing some rehabilitation in this process, and I'll go through the stages that have been advised thanks to Schmidt, Tyler and you 2012. The advice we gave to Jake before he went back to play was the importance of having eccentric strength. Okay, so when your muscle is strong on the lengthening phase, which his muscle strain was due to the stride in his sprint. So we've got him on some eccentric strengthening work, which is a while after he's done his early stages of rehabilitation. So things like Nordics, slow eccentric leg curls, and this is big bit of strength thanks to Lorenz and Romain 2011. Some good research there. So it's also been shown that the strength of the lumbopelvic region has been shown to reduce the chance of hamstring strain. So again, some modified versions of Pilates exercises, being aware of where your hip alignment is, your torso position, and increasing that strength throughout there. Not just the hamstring, but as a whole unit within your knee chain. So here are some the phases of the rehabilitation process that is to go on. So phase 1, these are thanks to Schmidt, Tyler and McKee 2012, which is been some good research here there, very thorough, and even gives you criteria for progression to the next phase. So full strength without pain, knee flexion 90 degrees, full range of motion, obviously no pain, and reduction in gait is obviously a sign as well. And building up confidence for this player to go back into full flight without having the thought of re-injuring. There we go, thanks for that. Thanks for listening to my clinical portfolio there. I'll go through all the references that I have here, and I'll leave you at that. Thank you.